Esquire.
You call me what?
Esquire. Well, nice to have you on the line. And I hope you are well. First time speaking to you. So, a happy new year.
Many happy returns, bro.
How is the health ministry doing?
It's work.
Mm.
Even during the Christmas festive season, we were still roaming, trying to get space for the 6 regional hospital.
Okay.
The president promised. This year we want to start with 3.
Okay.
Savannah, Uti, and Western North.
Savannah, Uti, Western North.
Yes.
Okay. You want to start those 3 this year?
Yes, please.
Okay. Okay. So, did you find the land we were looking for?
Yes. Well, the chiefs were very happy to, especially Savannah, when we got there, they gave us land for 2 different projects. We said we're going to do one district hospital also in Poly. So they were ready to give us this land. We told Uti and Western North, the lands are ready. The team will go to inspect it whilst we continue the documentation here in Accra. So we are working.
I see. Well, let's turn to what you did yesterday. In fact, yesterday, the minister, the chief of staff joined you to see off some nurses who are headed for Barbados and Antigua. Explain to us the initiative that has led to this.
So, as part of the president's agenda to manage migration, to make sure that persons or professionals who leave this country are followed by government instruments, followed by the government force in any country they go to, we have decided to put in place some ministries to form what we call the Ghana Labor Export Program. And then yesterday was the turn of the Ministry of Health, where some nurses and other professionals left the country to the Caribbean to assist in providing quality healthcare to the people there. So the Chief of Staff, the Minister for Health, and the Minister for Special Initiative who led this were the airport to bid farewell to these officers.
How many nurses benefited from this? Is it only nurses or other health professionals?
No, where I am, I don't have the breakdown, but we have about 121 health professionals who left yesterday.
So health professionals in general, not only nurses, there are other...
Yeah, there are other professionals.
Was this at the request of those countries, the 2 places involved?
So what we're currently doing is that we know we have become one of the best in the world and one of the sort of requested for professionals. So apart from the requests we are getting, we're also going to the countries we know these nurses and professionals want to go to, seek for the number of professionals they want, and then come and do the advert so that we can get them to go. These are based on some experiences and some information we have in the past that some of the professionals go and are not treated well because they go on their own. Their salaries are actually not paid promptly. Some are taken through some inhumane circumstances. So we decided that why not do this properly, get a market for them, and get them to go. So it is both a request and also going to look for the job for them.
I see. Are these persons already, were they serving the states or they were unemployed?
Thank you. Like any professional in the health sector who apply to leave for study leave to go do study or to go do any other work. We also have other groups who just leave the hospitals without our knowledge. So these are professionals who are working in the hospitals and want to leave. And then we, as part of how we manage our human resources in the country regarding giving study leave locally and internationally and making sure that when people want to leave, how do we replace? We decided to do this. So these are people who are working, and they have worked for a number of years.
Hmm. That's surprising because we know for a fact, and you know better than I do, there's a backlog of unemployed or nurses and other health professionals that you are yet to employ. Why are we not offering those ones rather?
Yes, if you are coming into the system, you are new, you would be under supervision. For some period, you would be on your own. The supervision will be lesser. So if you are given personnel to go work, you look at your. We don't just post anybody. We make sure that where we have access to post, we release them. So you cannot be posting people who have completed school and have not worked. We need to post those who have worked, those who have experience, and will not go and embarrass the country. They will go and lift the flag of the country higher and make sure that professionalism is exhibited there. So we are sending our best, making sure that at the same time we have enough to provide healthcare to the people of this country.
How does that benefit us? Because when you're talking about quality healthcare, you're also talking about experience over time. If you are giving away our best, how do we benefit from that? Should we not be thinking about retaining the ones that are good to take care of our citizens, and perhaps we give them those we've already spent money training, they retrain them there?
Yes, and you see, the system we have here in Ghana is such that it's not as though we don't have the personnel. We have enough. What we are currently doing is, as you are getting some to go support healthcare in other countries, those who are in the house get to join the system. I've heard the argument that like you just made, why are you giving out the best? We have a dashboard of all the health workers we have. As I said earlier, some specialists who are about 100 or 50 are not part of this. We don't post the sparse ones where we know we can post and also augment what we have, get others to enter, we do it. So this is pure HR management as well. Those who are in the house would actually go in to make the number that has just left.
I see. What do we get in return?
Yes, we get professionalism. We get people who go to learn other uh, skills from other countries to come. We get some remittances from these people. They will definitely send remittances to their families. We open up the system for other employment. We also gain some international recognition, like what we did during the Ebola outbreak. We sent Ghanaians out there to go fight Ebola, brought Ebola to the barest minimum, and came back to Ghana. It gave Ghana that edge when it comes to healthcare on the global stage. So it draws that attention to Ghana. If we are looking at health tourism, which is one of the agenda of His Excellency, these are some of the things you need to do. It means that when your people go out there, they exhibit that professionalism, and people will have courage, will have that, will not hesitate to go to Ghana for healthcare. So these are all the benefits we stand to benefit.
Let me understand this. Are nursing institutions or other health training institutions government subvented? you budget for them, give them money to support whatever they get from the students. Do you do that, right?
Yes, we do that.
So it means that we spend money in training these people. Additionally, nurses, they get the nurses training allowances. We do all this and we give them away without getting any compensation. They don't give us anything to say, oh, you have spent money in training these people, so take this one to at least. As some, we don't get anything at all.
So some of the countries we are currently having other negotiations with them regarding the tax. But if tax are deducted from their salaries, those taxes are shared with Ghana, whether they should pay for the services of these nurses. So we are looking at various negotiations currently for the other countries. But some of the countries may not be able to do some of those things, but we would be able to also gain additional knowledge from these countries. Your professionals will come back knowing the world state, what is happening. That these benefits may not come in cash, but may help your healthcare delivery in the future. So some of the countries we are looking at cash, some we are looking at other benefits.
I see. This is you said they were is it 120?
121.
121. Okay, so 121. Is it the first batch that this administration has sent abroad?
Yes, this is the first batch. This year we are looking at about 3 different batches leaving the shores of Ghana.
Oh, okay. Always a pleasure talking to you. Thank you.
Thank you, sir.
Thank you very much for making the time. Tony Goodman speaks for the Ministry of Health, joining us on the line. Of course, we're talking about the labor exchange program with other countries. In this particular situation, we have Barbados and Antigua. But do they spell it Ga? There's UA, but it's called Ga.
Yeah,
okay, Antigua. Okay, Barbados and Antigua, they are headed for those two places. Anyway, they say and partly there's an argument to be made for managing migration. They'll leave anyway. Most of them will leave. Most of the time, we have health professionals leaving on a daily in droves. Many of them, and we lose many specialists. Some of these nurses actually go and specialize because there's an opportunity for specialization here. SM, just across Kwalibu here. They do most of the specialist courses for the nurses. So most of them specialize, and then before you know, they are gone. Well, this is the minority led by Alexander Afenyomakin. People apparently call him Osahini. He's talking about this, the economy, and a few other issues.
Ladies and gentlemen, let me also address the issue of gold for reserves. We are not in any way opposed to that policy because the policy was started by us. We, the minority, are again not opposed to the institutionalization of a new vehicle to see to the implementation of that all-important policy. However, we have two major concerns. Concern number one, the establishment of the Gold Board as a regulator and also an operator is in a way directly encouraging galamsey activities.